pharmacy, your name tag should indicate pharmacy there. You can indicate your doctor there, but it should indicate you're a pharmacist so that nobody gets deceived that you're a physician. You are a pharmacist. Plain and simple.
But you go and see this person, and the person is, you may be naive, and you're having a conversation with the doctor, him or her, and you're, explaining a thing or two, and he's providing some education. Okay, this will best serve. This medication will do you good. That medication will do you good. That medication will do you good. In that kind of situation where you're limited knowledge, you are likely to say, if he is saying that or if she's saying that, then I might as well go with his or her advice. Or
Yeah,
at that point,
yeah. I mean that is it though. See, let's look at it this way. I also touched on the specialization for pharmacists. Now, when we out of school, we are general practitioners, just like a physician. You're a general practitioner,
okay.
and you could from there specialize into something else. The same thing as a pharmacist. All right. I believe that. So if you look at another angle of my piece is that, look, we have patients who end up at the teaching hospitals. They go on dialysis once or twice a week, and we have people who have kidney problems. We have people who have cancer and all that kind of thing. All right, diabetic patients who end up with their kidney problems. Okay, now this is what I believe in. I believe that for dialysis costs between about 700 to 2,000 per session. So if you have twice a week, you're looking at about 2,000 to 4,000 cedis per session. If that person lives for the next 10, 20 years, just put the math together. All right, you're talking about millions of cedis, a lot of money. And it's not just a lot of money, but you're talking about the impact on the healthcare system. All right, now about 45% of deaths in Ghana today are, the non-communicable diseases account for that. 45%, 43 to 45% of that. And if you look at that category of non-communicable diseases, you're looking at the cardiovascular problems, you're looking at hypertension, you're looking at diabetes, you're looking at respiratory issues. These are areas which are contributing massively to the non-communicable disease there. Now, my point is this: if we want to make a huge impact as a country, what we need to do is to make sure that we are training community pharmacists as experts in this field. Because let me give you a typical example. Look, the first point of call and the last point of call for most people in any country are the community pharmacies. They go to the community pharmacy first when they have a problem.